I'm a mom and a teacher, a wife, perfectionist.
Shannon's a planner. To her, being able to plan, being able to predict, being able to control the situation, that's her comfort zone.
We have my husband, Mitch, and me, and then Ethan, who is going to be 5 here pretty soon, and of course, Jameson. With Jameson, I always feel like he's catching up for lost time. Who is this? Who is it? There's a picture over his changing table of him and Dr. Lee. And I always tell him all the time, that's your best friend.
I think he's wise beyond his years. I think he's lived a lifetime in a short period of time, and there's a part of me that truly believes he knows what he's been through.
Hello, I'm Kate Kelly. 2 years ago, Shannon and Mitch Alcorn went in for a routine ultrasound and found something was terribly wrong with their baby Jameson that meant he was unlikely to survive. Desperate, the Alcorns sought help here at UCSF, where a team of innovative fetal treatment experts have been pushing the boundaries of medicine to learn how to heal a body even before birth. The road to Jameson's arrival and recovery was a bumpy one. But in the end, a surprising hero emerged.
So we got pregnant with Jameson, and we went in for our 13-week full check, and Mitch was actually joking with the lady, you know, oh, if you see something majorly wrong, would you say it? And she's like, well, yeah. And she literally, like, I don't know, about 20 seconds in, she's like, well, I'll tell you right now, I don't like that. And honestly, I thought it was a joke because, truthfully, I thought I was going there to basically find out, you know, for sure I was having another boy. And I mean, within like 30 seconds, she was like, okay, you're gonna have an amnio. No, you're gonna go to San Francisco. No, you're gonna this. And we realized very quickly that there was some problems.
Shannon Alcorn had a diagnosis of pleural effusions made by her local high-risk maternal fetal medicine specialist who did a fetal ultrasound and referred her to our fetal center here at UCSF for 2 reasons. One was to render a second opinion and make sure that the diagnosis was correct. And the other was that we're one of a few centers in the country that offer fetal surgery.
So this is the head, this is the neck, and this is all fluid around the lung.
Basically, Jameson's chest was full of fluid. And so his heart was pushed up to the right, and his lungs were completely collapsed.
A lot of times, if it's not too much fluid, we can just watch it and treat it after birth. And in fact, that's probably what happens to most patients like Jameson, is the fluid buildup around the lungs isn't too bad. In Jameson's case, it was severe enough that we were worried that he wasn't gonna make it to birth.
It became a whole lot more real, and you're just like, how do you know, what do you do if all this doesn't pan out the way you're hoping it's gonna pan out? You know, how do you even function after that, you know? And so that's when it started to finally hit me and started to get real, and I was just like, ooh, I mean, it got heavy.
It was pretty brutal, actually, the first meeting. You know, I don't know what I expected, but for someone to just be basically bluntly honest with you where you were at. We had no idea, I think, what we were really facing. The way they had laid it out to us, they would offer the surgery if there was an issue affecting his development or affecting him immediately.
And so after discussing it with our entire team, we decided that we should offer her basically a way to drain the fluid.
I wanted them to say, we're not gonna offer you the surgery, you know, your baby's got this. So when they basically put it back like, we've decided, these people who, you know, this is what they do, we're going to offer you the surgery. I knew in my heart of hearts that that meant we needed to have the surgery.
And they told us you're gonna go in and they're gonna put a needle through your wife and into the baby and put a straw into the baby essentially, and that'll drain the fluid. It's like, how is any of this possible on something this tiny?
Still to come, the UCSF fetal surgery team's first attempt to drain fluid from Jameson leads to disappointment.
Unfortunately, the first shunt that we put in came out.
I couldn't even get the words out to try to tell friends and family what we're facing.
But the Alcorn family is confident the UCSF medical team will find the solution.
They're gonna do everything they can to figure it out.
He's an old soul. He just seems to just know things that he shouldn't know.
He's a nut. There's a fire inside him that somehow, some way, he knew where he's been and where he's going.
The Alcorn family's hopes of having a normal pregnancy quickly faded when Jameson was diagnosed with pleural effusion, meaning his chest was full of fluid, compromising his heart and lungs. The fetal treatment team at UCSF was concerned Jameson would not make it to birth and was ready to intervene with surgery. The Alcorns had a tough decision to make, but they had a fighter on their hands. And even though time seemed to be running out and frustration was setting in, their bond with Jameson held strong, no matter how difficult things became.
In Jameson's circumstance, we were worried that there was going to be progressive damage to his lungs and to his heart such that he may not have survived. And so we felt the impetus to do some prenatal intervention.
It was tough knowing the odds are 50-50, that there's a 50% chance when we go in and try to put this shunt in, we could rupture the sac and you could lose, your baby. The pregnancy would be terminated.
You learn very quickly in the medical world, which we had never been a part of, that you have to have those real conversations, Nobody likes to have them, and the first time somebody sits in front of you and breaks it down, I think you always get a little offended. They are looking at it from a medical perspective, and this is what's going on with your baby, this is what needs to be done.
For me as a father, it was, if this gives us any chance of Jameson coming into this world and, being a part of us, then, we got to trust what they say, and we got to trust that they know what they're doing, and we got to trust that they feel this is our best option and the right time to do it.
We put in a shunt that drained the fluid from around the lungs to the amniotic cavity to try to minimize the amount of fluid so that the lungs could develop right and so that he wouldn't have squeezing of the lungs and the heart.
These are ultrasound images we took when Shannon was there for her procedure. My name is Vicki Feldstein. I work here at UCSF in the radiology department. This bright white line is the needle that Dr. Lee is introducing through her abdominal wall.
Jameson's the size of a tomato, basically, at this point. And they get the shunt in, and they're happy, and I'm listening to all this, and instantly they're frustrated.
Unfortunately, the first shunt that we put in came out, and that's a known complication of placing these shunts.
Getting the catheter to sit exactly where you want it can be a challenge. And then even if it all goes well and it is ideally deployed, it doesn't always stay put for as long as you would like. And it's not a risk to the fetus, it's just not getting the job done that we had hoped for.
So it's the very next day after the first surgery, and they're gonna do ultrasound that day to see how the fluid's doing. She's doing this ultrasound and she's not saying a word, of course. And then she starts scanning lower, and I'm like frantic at this point because I know this is not normal. I'm thinking, what is going on, Ken? What are they looking at?
Immediately, I had to have a very difficult conversation with Shannon.
I'll never forget this. He said, this is either going to be really good or really bad.
We got further diagnostic testing, all of which led us down the road to this is probably an early kidney cancer.
I'm thinking, what?
So this is the mass along the contour of Shannon's right kidney, next to her liver, the arrows pointing to the mass.
It hits you and it's like, man, your whole world is just crumbling. Like, what do we do?
My husband does not cry, and that was probably one of the first times I'd ever seen him he couldn't even speak.
You definitely go through some pity parties, 100%. How can you not? You definitely have the why me's, or why her, or why us as a family.
There was a lot to think about here. Well, what do we do? How does this affect Shannon if we do surgery or other therapies, chemotherapy, radiation now versus waiting a little bit?
Coming up, the Alcorns must decide whether to go forward with a second surgery on Jameson.
I remember thinking will I even ever meet you? I won't quit on Jameson unless he quits. I said I'd rather have a minute with him than nothing. I was all in.
We are gonna ride this out. We are gonna have this baby. We are gonna bring him home.
And the UCSF medical team begins to realize fate may be playing a part in the treatment of Shannon and Jameson.
If we wouldn't have been doing these ultrasounds to diagnose Jameson, I don't think we would have ever found this cancer until it was very likely too late.
It was Shannon that had said to me after the fact that, you know, she really sees Jameson as this, you know, save their family.
There's certainly irony here because the temporary complication of the procedure made us look at something we wouldn't have otherwise. That's when we took pictures of Shannon's abdomen and found a mass in her right kidney.
It was getting difficult for the Alcorn family to stay positive as the severity of their situation became increasingly distressing. Jameson, at just 19 weeks old, was facing a second shunt surgery to drain the excessive fluid in his lungs, while Shannon and Mitch were dealt another devastating blow. Shannon had early-stage kidney cancer. They were still holding on to hope, but by a very thin thread.
The delivery center, which is embedded in the women's hospital, is in the same hallway as the high-risk nursery. Shannon had cancer and needed not just OBs and routine delivery mechanisms, but she needed the entirety of adult medical expertise. And Jameson needed the entirety of neonatal medical expertise. And that combination really does not reside outside of UCSF.
I'm Janice Scudmore. I'm the nurse practitioner in the Fetal Treatment Center. I remember reading, whoa, does that say carcinoma? Are we worried about carcinoma? Am I looking at this correctly? Is that something we're truly concerned about?
Dr. Lee said, based on this mass, like, we might have to intervene. I said, I'm gonna tell you right now, I'm not doing anything about that until after Jameson's born. And he's like, okay. He's like, that's very noble of you. He's like, however, you know, if that mass grows, we're gonna have to handle it. I was like, okay, I'm gonna tell you again, I'm not doing anything. So we did this about 2 or 3 times, and he goes, okay. And I was like, okay. And so we let it be. And he goes, we'll just watch it.
Shannon's only overwhelming thought was, how is this going to affect Jameson?
For Shannon, it was always about the baby. And, you know, I felt like sometimes we were more concerned for her health too. And it was, we are taking care of both you and Jameson. So don't worry, we got you, but we need to make sure that you are also healthy and safe.
So now at this point, the shunt, you know, is not in him, and the fluid's built back up.
We had to put in another shunt after one migrated out. After we placed a tube, we could see decreased fluid around the lungs, and we could see the lungs start to expand. We were able to see what we wanted to was that there was less fluid around the chest and that the lungs were expanding. And so we were encouraged, and we watched this closely over time throughout the remainder of her pregnancy. The fact that there was still some fluid around the chest, we knew that there would be likely something that we would have to do after birth.
Coming up next, Jameson enters the world, but his life is in more danger than ever.
As much as it stings and hurts at times, it's like, just tell me what I'm looking at here.
I'm just standing there and I'm just thinking, oh my God, you know, like, don't let it in now. Jameson, he always wrote his own story. He did his own thing.
Jameson kept throwing curveballs, but we're in the major leagues here, and we see curveballs all the time. And so the next curveball that Jameson threw us was that in most circumstances, after birth, the amount of fluid will lessen and then go away. But in Jameson's case, it didn't.
The Alcorn family had endured months of fear, worry, and sadness, with flickering moments of hope that Jameson would make it to birth. Shannon put her own condition on the back burner, with the agreement that the doctors would monitor her mass, and a much-anticipated delivery date was scheduled. Now the Alcorns faced a whole new level of fear and were literally helpless as their baby was in the fight for his life. Their only recourse, to watch and wait. Turns out the hands they entrusted their baby to were very capable ones.
The minute he was born, he couldn't breathe. He wasn't placed on me or anything. He was instantly taken and he was passed through a window and there was a team waiting for him.
I described to the parents that it's a drive-through window. My name's Luke Judge. I'm a neonatologist at UCSF. When Jameson was born, he was immediately handed to our neonatal team. He needed to have a breathing tube put in so that we could support his breathing with a ventilator within minutes of being born. He needed the fluid that was accumulated in his chest as a fetus to be drained out, also immediately after being born.
So Jameson's up to 4 chest tubes at this point. They keep putting them in because they can't keep up with the fluid. They can't get it out fast enough, and he would clot off the tubes.
We had to have long discussions with them about whether to do surgery.
My name is Rachel Zumstein, and I work in the intensive care nursery at UCSF. My first thoughts were, wow, because he's definitely one of the sickest babies I've ever taken care of. His case was pretty rare, and I remember Shannon asking me, you know, how often have you seen this? I said, never.
At 2 weeks old, they said, listen, he might have surgery next week. You need to go home to be with your son, Ethan, because when Jameson has a surgery, he's gonna be sicker than he was.
I told her to go home. Not that I was trying to get her out of there, but you know, she had a 2-year-old at home. For her sanity, I said, go home, sleep in your own bed, shower in your own shower. It'll be good for your soul. And she didn't want to, but she took my advice.
Can't explain what it's like to leave a hospital without your baby. I don't know, held my baby and then drive, like get in a car and just start driving, like no car seat, nothing. Like it had never happened.
Unfortunately, the fluid never stopped, so we had to do surgery after birth to basically sew up where the leakage of fluid was coming from.
He was almost as sick as a patient can be that we take care of. I mean, if he didn't have those machines keeping him alive, he would only be able to survive probably for a matter of minutes.
It didn't look good. So it was then that I was feeling like, oh God, I didn't think he was gonna make it.
So it's about a week and a half, 2 weeks post-surgery. So I'm sitting there and I'm watching, you know, and all of a sudden Jameson's not breathing. And she's like, okay, hit it. So they hit the code button and talk about people. Everybody available comes.
You just see this mass of people and you are 100% helpless. There's nothing that you can do.
Just standing there and I'm just thinking, oh my God. You know, like don't let it in now. And I've only held him once and I can't even be in there because they're working on him.
We were focused on the baby, obviously, during the situation. And I remember looking at them and they held it together.
I hear someone say, Mom, where's Mom? They're like right there. They're like, give her a thumbs up.
When it was all over and she put her hand on my shoulder and she asked me if I was okay. I looked at her and I was like, am I okay? Are you okay?
It's really like riding a roller coaster. Sometimes there's immense ups and you're thinking this is all going to be okay. And then other times you're just on the downswing and you don't know if everything's going to be okay, but then you redouble your efforts to try to do the best possible. And certainly that was true with Jameson.
There were hiccups, but he was still alive the next morning. He was still there. He's still breathing. He's still with us.
Only several days after the surgery did the light start shining through that we thought that there was a high likelihood that we were through the deepest, darkest times.
You want to open your eyes? There you go, buddy.
When I got to hold him, it was more like, okay, things are going better. And then obviously the big turning points were when the chest tubes started coming out.
Everything lifted. It was just, all these pieces just started falling into place.
The amount of fluid within a couple of days dramatically decreased. And then very quickly after that, everything got better. His ability to breathe, first assisted by a ventilator and then by himself, improved dramatically to the point where when we looked around and looked at each other and we said, I think it's time to go home.
So to walk through those doors, That first night, to have them both bathed and in bed and just be like, we're all under the same roof for the first time. The urologist told me that basically if I hadn't had that scan, I probably would have, he's like, I probably would have met you in 10 years and you had been at stage 4 and I would have just managed you. Nobody catches renal cell carcinoma stage 1 because there's no symptoms of it.
By the time you notice this type of cancer, it's usually not a good time for us to talk. You know, it goes undetected for so long. So all of the pain and agony and struggles that Jameson went through to protect and save Shannon's life, I mean, you can't write that story.
I firmly believe that only at a place like UCSF, and maybe even only at UCSF, because of our expertise in the adult side and in the fetal neonatal side, would Shannon have gotten this diagnosis in a timely fashion. Sometimes you think, well, did all of this happen for a reason? And I think maybe it did.
Dr. Lee said, what if you walk this walk for you? And I was holding Jameson and I shot him a look and I said, I have a hard time with that. He said, think about it though. Without him, we would have never found that mass. He said, so maybe in the end, you know, that was what this was all for. Basically, he said, Jameson saved my life. Going in. Where's your room?
Oh my God.
Shannon underwent surgery to remove the mass on her kidney 3 months after Jameson was born. The doctors at UCSF were able to remove all of the cancer, and Shannon has been in remission for 2 years. Ethan is a 5.5-year-old and in kindergarten, and little Jameson isn't so little anymore. Now almost 3, he is a healthy and rambunctious preschooler. Shannon will continue to have yearly checkups, but has been able to resume her life and continue her career as an elementary school teacher. Thanks for watching. I'm Kate Kelly, and we'll see you next time.
Jameson saying it's a wrap.